Respected participants to the Second International Conference on Innovation in Teaching and Learning. My keynote focuses on the pursuing of complex competences in higher education. And just to give you a very good insight into what the exact focus of this talk is about, I want to give you a short video clip. And this video clip focuses on an innovation in our own university to pursue a complex competency in veterinary science students. More in particular, how could we teach them foaling in horses? And the aim of this advanced organizer is that it would introduce to you why we need to pay so much attention to this careful and gradual development of complex competences so that our students are ready to graduate. Now, the traditional approach to equine obstetrics, so foaling in horses, starts mostly with lectures. And here you see the expert in this domain, Art, and there you see a mare and you see a foal. And students are sitting in a lecture hall listening to his explanations, demonstrations, video clips, and so on. Of course, this questions the actual development of the competence in the students. So we needed, in fact, a way to upgrade the actual skills of students. And this was done by the design of a 3D package. And the students study this package in computer classrooms, and they study it independently or with guidance. They work with worksheets and work through video clips, exercises, and so on. But yet, this was still not okay. And we had the feeling we had to upgrade in another way, especially to build up these grounding knowledge, skills, and attitudes that are the base, in fact, of developing these competences. And this upgrading was done through an online learning environment. And in this online learning environment, we present the students with critical complex competences. And here you see a list of such competences. And more in particular, we focus here on the example, for instance, how to prepare for surgery and how to put on your, gloves. And the students can watch video clips, they see the principles, they see the theoretical base, and then, very critically, they also take a test before they go to the actual OK. And this they do in relation to all the different complex competences they need in the classroom. But yet again, we think this is not enough. And therefore we designed Skills Lab, where students, after taking the tests in the online environment, start doing it. They start doing it in a more protected environment. So here you see, instead of a real-life horse, you see, in fact, such an artificial horse that you even can open up. And here you can find the arteries, you can, in fact, do intravenous injections. Here you see how they treat dogs and cats. And all the time you see in these different stations in the skills lab how they assess themselves, how they assess their peers, and how they focus on scripts. Scripts they follow to guarantee that they apply the right knowledge, the right skills, and adopt the right attitudes. And after being trained in the skills lab, only then have they access to the actual operating surgery devices. Okay. So again, initially there is a theoretical introduction. The students take really theory and they take tests before they come to the skills lab and actually before they then move to the actual surgery setting. In our opinion, this guarantees the better development of skills, their competencies. Research linked to this endeavor also shows that it really helps. So the thing is, what will we do about complex competences in higher education? So that's why I start first with critical voices, whether our students are really ready for the profession, whether they're employable. And then I will focus on these complex competences again, by discussing the nature of these complex competences and by discussing the need to set up learning trajectories. And then I will give some examples, especially building on teacher education. And the lessons learned will turn back to our initial questions about, how do we pursue complex competences? Well, these critical voices, you really find them in the literature. And they question the outcomes of higher education. Are our graduates really ready for the profession? Are they employable? And we see when we read the literature, there are different types of expected outcomes in view of this readiness for the profession and their employability. For instance, here you see this big discussion about employability in a rather recent conference in Spain. And you see there's little consensus about it, but especially they discuss that it's not only an instrumental economical perspective that should be adopted in view of employability and readiness of the profession, it especially needs a holistic development. So a development of all knowledge, skills, and attitudes being developed. Another study recently published in the microbiology letters shows that, well, when you discuss with employers, that they especially focus on, well, what do they need to be able to do? And you see, in fact, separating the development of graduate attributes from subject knowledge through a framework of extracurricular sessions is very successful. Well, in this article, they stress, don't do this in a separate subject, in a separate course. Employability, readiness for the profession, so the development of complex competence should be done all the time and through all the different courses. Again here, an employer perspective stresses that we don't have to focus only on very useful basic skills, basic competences, but also here at the bottom, you need very specific complex competences that have to be mastered by these students. And what this article also stresses is that it really should be the focus of higher education. The article also stresses that currently too little attention is being paid to the development of these complex competences in view of readiness for the profession and employability. But the nice thing about this article is too that it shows these different skills and the types of skills that are related to readiness for the profession. And that's what we do in this, in fact, keynote. We focus especially on a sub-part of these skills. We focus on the specific ones, not on the generic communication, teamwork skills and so on. No, on the specific ones that are really, in fact, important in view of having an excellent graduate in our training. So from the perspective of graduates, employers, and also in view of being valuable for the job, we focus on a specific set of skills. And we call them the complex competences. An example, for instance, in the United Arab Emirates, a study was set up in relation to what teachers really master in view of their competences. And here you see 11 key competences of teachers. And we asked to what extent they have been taught, or present in the curriculum, or being practiced, or being modeled, and especially to what extent are they mastered by the students. And compared to an 80% benchmark, we see that many of these competences are not yet at par with this 80% mastery benchmark. For instance, adapting to the need of individual learners, meeting the demands of individual learners, dealing with colleagues or parents, being able to plan and adopt strategies. And all this has not sufficiently been trained. So what happens is these students are put in real-life internships but are not ready for the profession, thus leading to dissatisfaction in employers and students. So the key problem for today is these complex competences. What are they? Well, in fact, complex competences, they build on an integration of earlier learned knowledge, skills, and attitudes. So it's an integration. Of course, at the basic level, we need to develop in students a very strong knowledge base. But when it comes to applying this knowledge base, we need to pay, in fact, a lot of attention to the higher acquisition levels in our higher education training. The same applies to the content categories. We need to pay more attention to the higher content categories. We pay a lot already attention to factual knowledge, conceptual knowledge, but we also need to look at the procedure and the metacognitive knowledge. So combining these higher level in behavior and the higher level in knowledge, our higher education should focus on complex competences, this domain in Bloom's taxonomy. Now, what's the nature of these competences? Well, we already stated it. It's in fact something that we have in our cognition. It's a disposition. So it means it's cognition, but it's also affect and motivation. And it builds, in fact, on knowledge and behavior in our students. And we have to develop it through learning trajectories. So it means we need to develop, in fact, this from the start in higher education. So studying complex competences, learning complex competences is not done in a separate subject or course. It's something that's done through an integration of what we acquire step by step at the level of our knowledge, skills, and attitudes. So it should be an integration of whatever we learned in earlier courses in a second, third year. Now, let's look again at an example. For instance, medical education, where we strongly focus on, for instance, development of consultation skills. And in this picture, you see that initially we train separate knowledge, skills, and attitudes in students, but then it comes together in the third, fourth year where we integrate this and we put students in situations where in a safe way they can start training this. First online and later face-to-face, for instance with mock-up patients, or then much later on in real-life internship settings. So patient consultations, well, it's not an easy skill. All doctors, medical doctors, all students will say, well, that's difficult to learn because it's real medicine. And it's something that goes beyond simply adding up all your knowledge and skills. It's really need to train it in an integrated way. So we integrate knowledge, skills, and attitudes. And we develop a script that explains the steps you take. What do you first? What do you next? What do you the next again? And what do you pay attention to all the time in terms of attitudes, affect, and emotions? So here you see how the disposition of a complex competence goes back to the knowledge and the skills and the affect and the emotions that you need to develop a good patient consultation. In the literature we find many of such scripts, but then it comes to training them. And here in this video clip you see how medical doctors in Vietnam are being trained to adopt such a skill. They hold here their own, in fact, scripts, and then they train the scripts in a real-life setting. By the way, these are professional doctors being retrained. So what about our students? Well, in our students we adopted several online training, face-to-face clinical simulations before we put our students in a real-life setting. And what we discover is that this gives us a better guarantee that they master these complex competencies. And let's move now to a second example in the field of teacher education. When we look at the literature about teacher education, we see that while many things are criticized, for instance here, the lack of link between theory and practice, that the evaluation is focused too much on quantitative things and too little on the skills. And there is a lot of lack of attention being paid to attitude, disposition, habits, and interest in teachers. So what we did was, we studied, for instance in our setting, what is key in terms of not being developed in our teachers. And what we see is that dealing with parents, classroom management, dealing with aggression and bullying, giving good feedback seems to be too weakly developed, especially prior to being involved in an internship setting. This led, in fact, to the selection of some of these competencies to be trained in a new way. So we developed, first of all, a script in relation to how to deal with parents. And the script is here described in a general way, the steps you take, and in fact some flow, things that guarantee that you pay in a transversal way attention to attitudes and emotions. And next to our students, they are put in online simulations. In this case, a teacher is waiting for a parent entering a parent-teacher conference setting, and parent is entering. And the students have to watch this, and all the time they have to ask and answer questions. They can do this individually, or in pairs, or in little groups. Okay. This online work is in fact a second step and first step in fact a way of doing it face-to-face. After students are introduced to a script, and after they have been working in online situations, they deal with this complex competency in a face-to-face clinical setting, where they are working together with actors. And these actors, they play, in fact, a kind of standardized parent. Here you see the student waiting. There's a knock on the door, and these actor parents enter the room. It's a clinical simulation. It's face-to-face. Two other students are present and observe what's going on. This is a very stressful situation, but still, it's in fact a very safe situation, because actually they can make errors without being affected in a real-life setting. Another example focuses on the complex competence of giving feedback. Again, as in the former example, we develop a script in students. And then we invoke in these students perception, interpretation, and decision skills. They have to watch, they have to make an interpretation, and they have to make a choice for what will I do. So we will present them all the time with questions as to what they see, what they consider as being happening, and what they would do. And in this second example, we work again online. And the students, they will see an online script, and they will see online contexts. They click on these contexts, and you see here a black screen where all of a sudden you see video recordings of real-life situations. The green blocks here on the timeline, they point at certain questions that have to be solved by the students. Pitch questions, perception questions, interpretation questions, and decision-making questions, so that the student teachers all the time reflect on what they know about the scripts, and how they would react without being distorted in their emotions. So, what did we learn? Well, throughout this presentation, we try to stress that employability and readiness for the profession depends not only on the mastery of very generic competences or skills, but also very specific ones. We call these specific skills complex competences. And these complex competences, they rely on an integration of knowledge, skills, and attitudes. And they should be developed step by step in a learning trajectory in an academic career. And to do this, we should develop scripts that guarantee that the correct knowledge and skills are being deployed and the right attitude is being adopted when dealing, for instance, with a consultation skill, dealing with aggression, dealing with bullying, and so on. Training students to adopt these scripts should be done in clinical simulations, and these clinical simulations should be set up first online so that they are very safe. Next, they should be done in a face-to-face situation, for instance with actors, and this before we introduce to students a real-life internship where they can in fact tackle more risky situations without in fact the feelings of stress that they experienced in the past, and without in fact getting this feeling of I'm not ready for the profession. Thank you.